So how have you been doing?
I'm okay. I was thinking I should turn around and you can see my back.
I
And
think that's a
do
wonderful idea.
you want to do it now?
Sure,
Okay, let me take this off. It's
that'll be
actually
helpful.
it's 72 in here, so I'm feeling cold. I put longer pants on and it seems weird because in the winter that's hot.
Right, but our temperature, our blood actually thickens as the temperatures get cold. So you know how
I
it
don't know
is.
if you can see with this shirt. Well,
All
let's
right,
see. Can you see or do you want it up more?
I can see. I just need you to stay one direction. There we go. Okay. We're going to take that resistance band.
Can I show you this way though too? Because this, of course, this side's out more than that side.
And how about the other direction? And let's go from the front. All right.
I don't know if you can see with this.
Kind of, sort of. Okay.
I think my shoulders are are definitely more even.
Very much so. Oh, let's have you stand up again. All right. I want you to bring both arms up overhead. All right. And inhale. And exhale. And inhale. Hold it. And exhale. And inhale. And exhale. And inhale. And exhale. Okay. Now I want you to bring both elbows back. So just kind of do a 90-degree bend at the elbows. Yep. And inhale. And exhale. And inhale. Hold it. And exhale. And inhale. And exhale. I want you to turn your head slightly to the right. And inhale. Hold it. And exhale. 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 Bring that left elbow up. That's horizontal with the brown. Perfect. Turn your head to the right. And inhale. Hold it. And exhale. And inhale. And exhale. And inhale. And exhale. Now bring your hand up. Keep your elbow where it is. Then just bring your hand up. And turn that head to the left, to the right, I mean, sorry. And inhale. Hold it. And exhale. And inhale. Hold it. And exhale. and inhale. And exhale. Now bring the left hand to the left shoulder.
Left hand to the left shoulder.
Yep, perfect. Keep that head bent to the right. And inhale. Hold it. And exhale. And inhale. Hold it. And exhale. And inhale. Hold it. And exhale. And inhale. And exhale. Head to the center. Inhale. Exhale. Inhale. And exhale. And inhale. And exhale. And bring that left arm down. And the right arm down. Whew, that's hard work.
Watching me?
Uh-huh.
Nope.
Okay, you can sit down. So how did that feel?
It's fine. I felt a little bit along the, along the spine. This morning when I was doing body pump, I felt it on the this side, the right side,
The right side.
along the spine. It was tight.
Okay.
Yeah.
So yeah, we were kind of using that arm muscle to get and the ribs in different ways to kind of get into different parts of the breathing. So yes, I was watching how your breath was coming in from the right to the left, how your shirt was shaping differently, and what muscles were activating along the spine.
Mm-hmm.
So this morning with body pump, you felt the muscles, were they being tight?
Just along the spine on the right side.
On the right side. Okay.
Under the shoulder, what is that shoulder blade? The blade.
Right. Do you by chance have your stick with you?
I do. I don't even have to get up. It's right here.
I figured you'd be that. Yeah.
Just
All
so
right.
happen to have it right here.
Awesome. So you're going to take that stick and you're okay. I'm watching to see where the glass is, around you. So let's have you bring that stick up in the air.
What glass?
Any glass. How about the shelf that's right behind you?
It's over here.
I know.
What? Oh,
That's still close, so I got to watch. Okay.
well, I can move.
Let's have you move forward just a little bit. All right. So you're going to take that stick.
Oh,
Once you're done sweeping.
trying to get this other thing to move so I can move this out a little bit, just so you have clearance. Okay.
All right. So we're going to have you lift that bar up overhead. All right. And inhale. And exhale. And inhale. And exhale. And inhale. And exhale. Doing okay?
Yeah, I did this last night. Maybe that's why it's muscles tight or something. I don't know. I did
Okay.
this.
So we're going to bend the elbows slightly, bring that down. Right about there. Can we straighten? Is the bar straight?
Well, I can see it's not straight on there, but
Okay.
I think I'm at an angle.
Yeah, that's why I thought I'd ask.
This should be straight.
Perfect. Yeah, looks straight in my screen. Wow, that is straight. All right. And inhale. And exhale. You're gonna have to work hard to keep that bar straight. And inhale. And exhale. And inhale. And exhale. Turn your head slightly to the right. and a little more. Perfect. Inhale. Hold it. And exhale. And inhale. Hold it. And exhale. And inhale. And exhale. Back to the center. And inhale. And exhale. And inhale. And exhale. And inhale. And exhale. And turn to the left. And inhale. And exhale. And inhale. And exhale. And inhale. And exhale. And inhale. And exhale. Doing okay?
Yes.
Awesome. Bring those elbows down a little bit more.
Okay,
Try
because
to
it was
bring
getting
that
a little
right
heavy.
about. Okay, it's okay. Says the woman that just finished up body pump this morning. You got this. All right, make sure that bar is straight. And inhale. And exhale. And inhale. And exhale. And inhale. And exhale. And inhale. And exhale. Turn the head slightly to the left. And inhale. And exhale. And inhale. And exhale. And inhale. And exhale. Back to the center. And inhale. And exhale. Inhale. And exhale. Inhale. And exhale. Back to the center.
I am in the
Oh,
center.
okay. Go to the right and inhale. And exhale. And inhale. And exhale. And inhale. And exhale. Inhale. And exhale. Back to the center. And inhale. And exhale. Inhale. And exhale. And inhale. And exhale. Now bring that bar back towards your head. Can you go bring it behind your head? Whoop. Yeah. You need a break, don't you?
Yes.
Oh, how does that feel when you're doing that?
Well, I can tell it's doing something.
Good. Let's bring the bar directly right here. Yep. Up a little bit. Up right there. Yep. All right. And I want you to inhale. And exhale. And inhale. and exhale. And inhale. And exhale. Turn slightly to the left. And inhale. And exhale. And inhale. And exhale. And inhale. And exhale. And inhale. And exhale. Back to the center. And inhale. And exhale. And inhale. And exhale. And inhale. And exhale. Turn the head to the right. And inhale. And exhale. 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 Bring the head back to the center. And inhale. And exhale. And inhale. And exhale. And inhale. And exhale. Doing great. Bring that bar down 3 inches. Lower that. No. Too
My
much.
hand's falling asleep, actually.
Oh, yeah. Then we don't like that. All right.
Just taking a break. If you want, I can do that. But I was just
No. I totally get that. There was a lot going on. So one of the things that, we were working on at the very beginning too was also your neck. How does that neck feel?
good.
Okay. It's got a lot more range of motion and movement going on in it, doesn't it?
Yeah. Just generally, even.
Yeah. And less pain and stiffness. And so.
I haven't had that recently.
Good.
I know that's Grace's issue. And I'm like, well, that's her issue. It's not mine.
Right. And, a lot of issues can also be, maintenance, different issues, different people, different places, different injuries, different, repetitive motion, different reading or phone holding. Yeah, everybody's different. And you're doing a fantastic job of really maintaining things though, too. You're doing these exercises along with other exercises that are meant to keep everything all together, but these are really very specific. In fact, would you like to take a break and learn a little something?
Yeah. Are we ever going to get to the band, or are you deciding not to do it today?
Nope, we're going to get to the band.
Okay.
Okay, I just want to give your arm just a little bit of opportunity to kind of rest for just a sec. Where'd it go? There we go.
Hate to tell you, but it's blank. No, there you go.
Okay, because I meant it for it to be. So what we're doing is working on these back muscles, on the intercostal muscles that are inside the ribs here in the middle, on the transverse abdominis, as you're opening things up. So even like by putting that bar up, it's getting right into these shoulder muscles and it's evening out those. Again, I can't change bone, but we can change how the body interprets where the bones are positioned. Let me see if I can kind of, I don't know if you can see this one onto this side over here. Would that be the right side?
I can see it.
Okay, good. So we're including that diaphragm in there along with even the breathing and the neck. And that's why so much of the time it's like, but my neck doesn't give me as much trouble because we're working with using into these neck muscles as well. So we're evening things out as we're kind of progressing through. So this is an example of somebody that's putting on their shoes. You can see how that hump is.
Mhm.
So it's kind of indented there, a little bit tighter. Usually there's a hump here and then a little bit more tightness here. This kind of concaves in and this runs forward.
Mhm.
So, and the reason that we're doing the breathing, you know, this happened to have the feet with it too, because, you know, we work with that too. But most of the time we using the chair, especially with the Zoom, because, but that breathing, kind of the lifting up, so that spine and that whole system kind of lifts, kind of that breath to the top of the head. What's happening here too is you've got your vertebrae, your spine, and they stack onto each other, or in some cases they curve a little bit, sorry, onto each other. But then the rib comes around and that goes to the front where that sternum is, right in the front of the rib cage. So that's why that breathing, even though we're doing things in the front of your system, even in the front, you're still feeling things going on in the back. And then we're using our arms kind of as levers as well. So as we get older, these little, I call them, you know, base in between the joints is, I call them marshmallows. Basically, it's a very squishy surface, but as we get older, that squishy surfaces gets compressed down and there gets to be less hydration, where they say drink lots of water. Part of that is to hydrate the connective tissues that are in between the bones, because that in itself can help to kind of take away, it can reduce pain because you don't have things compressing on the bone because you've hydrated those spaces. But we're also getting into these joints around there through movement. So we're using these scaling muscles. Again, those muscles are all attached to the neck. I know that's a big thing for you, you know, my neck area. So you can see the first rib here, but all of these scalenes are attached to the cervical area. So if that's kind of kinked or a little crooked there, and there's more tension on one side, or it can feel almost pinched. Numbness can, yeah, numbness, tingling can be more of a nerve, because the nerves come off in between these muscles as well. So we're
That's
also
weird. Yeah, this is tight, and yet this is the arm that fell asleep. Or the hand, anyway.
the hand that fell asleep.
Mhm.
Yeah, it could have just been up for a little bit longer than it liked.
Yeah.
So again, we're kind of working into all of this thoracic area and just kind of really opening up that rib to make things stand taller. We're working, your breathing muscles actually are right here, but it lifts everything. And we're working on that erector spinae. When we get these multifida and the erector spinae muscles strong, then your spine straightens and stays that way, theoretically. So that's why we're working on the breathing. Even when you're turning your head a little bit, it's engaging the muscles just a little bit differently along the spine. So there's a lot going on when you're just taking a breath. So here's another way. This is actually from the Science of Yoga book that I have, where the diaphragm contracts and it allows, so as you're breathing in, as you you inhale, that fills up the diaphragm, the lungs open up, filling up with air, and then rib cage expands, there's more space in the chest, your lungs at large filling with air, and then as you exhale, the diaphragm contracts and just really allows the lungs to come back down. So you're strengthening those lungs as well, kind of that inhale, hold it, exhale. And then by turning your head a little bit, you're getting more space up in here or in here, as well as behind, to give all of the joints more space. So there's a lot going on as you're breathing in and out. It's kind of like a pail that has a handle on it. So it's lifting up, it's coming down. It's lifting up, it's coming down. Your ribs are coming up and coming down. So on all of those muscles, and that's why you get fatigue though too, all of those muscles in between those rib cages, we're taxing them by making them hold things and do things. The diaphragm goes right underneath that lungs. You're getting into the quadratus lumborum down here. There's a lot going on. So this happens to be somebody and how their curve is. They kind of have a little bit more going on in the right and more of an indentation going on to the left. And that's pretty common. So it's like if you take a traditional yoga class, a lot of times people will do a spinal twist. Spinal twists are great to go and give more joint mobility, breath into the different parts of the body. But basically, scoliosis is basically like the activation of that curve. See how kind of the left is tight and then comes across to the right. Your body's just basically kind of stuck in that position when you stand up. And that's where it's like that sclerotic curving, but your body just basically got stuck that way at some point in time, where it just needs some strengthening in different areas. And here's how, as you're trying to, here's how your joints are kind of right in that yellow area, kind of, those are that's the areas of insertion where those can be a little bit tipped. And so that's the connective tissue that we're stretching and then the strengthening the muscles so that they stay more erect. But seems kind of like this, but you're kind of in that position most of the time. So again, we're working with the inner core muscles. All right. And I've bored myself enough. All right, let's take that bar again and bring
I
it
want to
back
tell
up.
you, when I turn this way and that way, this way is a little tighter.
Yep.
Not too bad, but it's a little tighter.
Okay. So we're, you know what? Yeah, we're going to do one more time of this. So you're going to bring that up and back. And is it a little bit lower than what you had before?
Yes, it is.
Okay, perfect.
I was up here and
Yep.
now I'm here.
And that, perfect. Because that's going to get in different vertebrae. So I want you to inhale in again. Hold it. And exhale. And you're sitting on the front of the chair, right?
I'm actually on the cushion. Should I get off?
Nope, let's just have you slide towards the front.
I'm on that cushion.
Oh yeah, you're fine. And inhale. And exhale. And just a little check, is the bar straight?
Think so.
Okay. And inhale.
The window's not
Hold it.
straight.
And exhale. Right. Optical illusions. All right. And now turn to the left. Keep the bar straight. It didn't. Yep. There you
Really?
Yeah. And inhale. And exhale. And inhale. And exhale. And inhale. And exhale. And inhale. And exhale. Head back to the center. and inhale. And exhale. And inhale. And exhale. And inhale. And exhale. And turn your head to the right. And inhale. And exhale. 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 Turn back to the front, neutral spine, and inhale. And exhale. And inhale. And exhale. And inhale. And exhale. And bring the bar back up.
Oh,
You okay?
I just need a break.
That's a lot of hard work, isn't it?
Yes, it is.
I know you like I know that you like exercises that give you feedback.
Uh-huh.
Welcome to another way to use the bar with a heck of a lot of feedback.
Yeah, there you go.
So we don't want to hear as hands are tingling, so just use loose hands. Doesn't even have to grip it, just kind of place it there
Okay.
and take a break when you need to. But can you feel how that really kind of forces the upper back to engage differently?
Yes.
Than
Lot of action back there.
yeah. So I've been kind of playing with the bar and kind of going, how can we utilize that and use it? So it's actually opening up the front at the same time it's engaging in the back, just and really getting into these breathing muscles.
Yeah, I felt it on a muscle, some muscle somewhere.
Yeah. So it's pretty effective and it kind of forces your bones to kind of work together. Where originally we kind of had them working separately. Now it's kind of time to like have
Yeah.
them work together as much as they can and unify what we've done.
Yeah. I like using the bar because it does make my right and left even.
Yeah.
Like, tells them this is straight. This is what even is.
Right. And utilizing that as a tool, it's also a great check-in where it's like, oh, okay, when do I need to go back to like a previous week's lesson and kind of go there because it's not quite where we need. But this one is going to be a good one. If it gets to be too bothersome to bring it behind your back, we'll come up with something else. But, and as you did, it's like you kind of take a break when you need it. But it's a great one to kind of, you can probably skip about 4 other ones and just do this one at this point. Yeah. So do the ones you like in this one. So,
Sure.
okay, resistance bands. Let's pick that baby up. And it's tied in a knot. So you're going to take both hands and you're going to put it on the inside.
Outside, looking out, going out.
Yep. And you're going to have your elbow straight.
Straight. Like
Yep.
this?
There you go. And now push your hands away from each other. And inhale. Best you can. And exhale. And inhale. And exhale. Nice. And inhale. And exhale. And inhale. and exhale. Inhale and exhale and relax.
Ugh.
That's exhausting, isn't it?
Yeah, I felt that along my right vertebrae, that muscle.
Yep. So it's what happens. Let's see if we can. Let's go back to here again. Okay. So when you're going and pulling your arms away, it doesn't do much, but by having a resistance there, it's kicking into these muscles right here between that 1 and 2.
Mhm.
And that's really engaging those
Mhm.
into those erector spinae muscles and these intercostal muscles. And it's really getting them stronger to like, okay, my arms just want to like fly back together, but you're like, okay, and now I got to breathe too. So all of these muscles are going, holy crapola. But it's like, no, it's time for you guys to work together.
Mhm.
So just kind of make sure that one side isn't overpowering the other, that you've got similar strength to both sides. Because now it's time to really engage both sides alongside of that spine right here and
Mhm.
enter these muscles.
Yep,
Does that make sense?
yep.
Okay. Yeah. So it's time to do it again.
Okay.
And pull. Yep. And inhale. And exhale. 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 Inhale. Exhale. And relax.
I really felt it along here and then along my spine on the right.
Does it make it angry?
No,
No.
but it's like I feel it over here and I don't feel it over here. And it's supposed to, I mean, they're even, so I just talking to this part, hey,
Hmm. Okay. You've got a pull. Ho, 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 ho. Oh. Let's put the resistance band over one side of the pole.
like this.
Yeah, except for trying to think of the best way to do that. Put the resistance band underneath your right foot.
You want it on the pole?
Not
No.
yet.
Okay.
Underneath your right foot first.
Okay. All right.
Let's ignore the pull for now. I might change that. I want you to take your left hand
Mm-hmm.
and grab the resistance band.
Mm-hmm.
I want you to keep your elbow straight
Mm-hmm.
and to sit up, and I want you to pull that left arm up towards your left shoulder. Keep the arm straight. So I want you to basically come across like that.
I am.
Okay. Am I seeing your hand?
Wait, like
Okay.
this.
Keeping the arm straight. So
Mhm.
come to your right knee first.
What?
That's your right knee, right?
This is, yeah.
Okay. So bring that left hand to the right knee.
Left hand to the right knee. Okay.
Yep. Resistance bands on the right foot, right?
Yes.
Okay. So bring that left hand up. Keep it on the right side this time.
Okay, you have to know this is all the way it goes.
Oh, okay. Then pull it up as high as you can. And just keep it there. And inhale. And exhale. And inhale. And exhale. And inhale. And exhale. And relax. You okay?
Yes.
Does it get into some of your left spinal muscles?
Yes.
Okay. You're going to take that resistance band, you're going to put it up by that right knee.
Yes.
Okay. Take the resistance band and put it underneath your foot.
Oh, you do want me to do this? Okay.
Now I want you to, basically it's like putting your leg inside a sleeve of a resistance band.
I actually don't have my foot in the resistance band because it's so short. I have it on it though.
Right. So slide that resistance band around your knee. So half of it's underneath your knee, half of it's above your knee. Like you're putting on a pair of pants with that resistance band.
You want me to put my foot inside of it?
Yes.
Okay.
Apparently
Like,
words don't come easy to
like
me right
this.
now. Yes. Okay. Because your band is shorter.
Yeah.
All right. So keep that right leg strong. Bring that left arm to that right leg.
Oops. Oh.
And then I want you to keep it as close to the right side as you can and pull up.
Close to the right side because I have it on the left. Do you want me on the right like this?
Yep. Keep that elbow straight. And I want you to lift up.
I am lifted.
On the right, a little higher. Keep that elbow straight right there. And inhale. Hold it. And exhale. And inhale. And exhale. And inhale. And exhale. And relax. Okay, whereabouts did you feel that?
That's it.
Okay,
I felt more when I had it on my foot, but
okay. So we're going to try that again where it is. And you're going to flip your hand the other direction so that your palm is up.
okay.
Okay, extend your elbow out. And this time I want you to actually bend the elbow towards your left shoulder. And inhale.
That's a stronger muscle.
Yeah, inhale. And exhale. Yep, make sure your shoulders don't shift. Yep, and inhale. And exhale. And inhale. Exhale. Inhale. Exhale. And relax. Okay. Could you feel that on the left side?
Felt it here, here, and a little bit under the shoulder blade.
Perfect. That's exactly where I want you to feel it.
Okay.
All right. And let's do her again.
Oh, okay.
Yep. And bring it up. When you get it to a point of where it's tight enough, then just inhale. Using that isometric exercise to build the strength, and you're getting more oxygen to the muscle through your breathing, as well as incorporating strength in the others muscles. And relax.
Oof.
Doing okay?
Yep.
Starting to feel a little bit?
Yep.
Okay. And one last time. And inhale. And relax. We're done with the resistance band. So I want you to go back to the bar and bring that up overhead and behind.
You want it right? Which one you want it? The lower position or the higher
Lower
position?
position. Lower position just to do a check-in.
Okay.
And inhale. And exhale. And inhale. And exhale. And inhale. And exhale. Turn the head to the left. And inhale. And exhale. And inhale. And exhale. Inhale. And exhale. Back to the center. Inhale. And exhale. Inhale. And exhale. To the right. Inhale. And exhale. Inhale. And exhale. Inhale. And exhale. Back to the center. And inhale. And exhale. And inhale. Exhale. And relax. Did the muscle engagement feel a little different?
It didn't hurt. I don't know if I said it did before, but it felt engaged, but it wasn't like agitated or.
Okay, because before you said that you felt it on the right, but you didn't on the left.
Oh,
Does it feel like things are engaging on the left now?
a little.
Okay,
Mhm.
more than before.
Yeah, I think so. I wasn't paying
Okay.
attention, to tell you the truth.
Okay. I try to pay attention as much as with the information I've given. Yeah. So, but yeah, it didn't seem like I thought with the resistance band, maybe you might get a little bit better reaction. And it
Mhm.
seems like you did. So if you kind of start to feel like one side, like the left side isn't kind of working, I think that this would be a good exercise to incorporate to get that left side stronger.
I was thinking since I'm right-handed, this muscle's probably not as big as this one anyway. I probably
Right.
favor it. And
Right.
because I have the hip, I can rest stuff on it. Because it goes out like that.
Well, all right. That is true. So, okay, cool. Well, what questions do you have?
I don't have any about my body. I don't have any this minute.
Does that mean you've got some about your mind?
No, I have questions about like the YouTube thing and that private versus um
So it turns out if I put it as private, it's private where I can see it, but you can't, even if I share you the link.
yeah, I did get into some of them, so I don't know if you put some of them unlisted.
Yeah, unlisted seems to be a way that I can share the link with you and no one but you and I see it.
Right.
Private means only I get to see it. Even if I give you the link, you don't get to see it.
So I'm going to go through and see what I have and tell you which ones are just not letting me in.
Okay.
I
Gotcha.
kind of I feel better having them than not.
Oh, totally get that. Totally understand that.
Yeah.
So,
Well, no, I don't have questions because it is what it is, and we've been working it, and that's good.
do you feel like it keeps, are we at a point where it keeps changing? Or is it just maintaining now?
I want to think it keeps changing.
Okay.
I mean, and also just muscles that I wasn't using or haven't favored, and I can do a chair a lot easier because I'm using those muscles more. And I
Mm-hmm.
really I like putting your bottom behind there because today I was just doing it without that. And I'm like, yeah, but how does my hips know what even is? You know what I mean? Like I could
Yeah,
be completely even here, but my hips would be off. So I like that gives me like confidence that it's telling the body the right thing.
right. Well, and it's also giving the brain feedback and said that saying, here's where your hips are even. And your brain's going,
Yeah.
okay, I'm okay with this. So you're doing, by having something against it, it's giving that brain feedback and going, okay, I'm good with this. So cool.
Yeah. Other
No,
than that,
things are looking really impressive.
oh, good. I mean, from your perspective.
From what I can see. So how do you feel like when you're doing the body pump that you were doing this morning? Does it feel like that's getting easier?
Well, no, that one day was off. Everything was hard a whole day. But usually it's okay. What is easier is I used to have to wear a thing on my left knee, which I don't use anymore.
Okay.
Um, because I thought it was because that's the one that had Prolo on and it had stretched ligament. I thought that's why I was using it, but I think it was because my left to right was so off.
Mhm.
And then I'm not having trouble with the right knee either. Which I started having more trouble with the right knee. And even hiking, it would start to hurt when I was hiking. So I
Okay.
thought, eye roll,
Yeah.
falling apart.
So, so how is hiking feel now to you?
I don't have this. Well, I don't know. I guess I think it's better
Okay.
because I was thinking how long are my walks? Are they an hour long? Yeah, they're probably an hour long and they're not hurting. Because before something with my knee wouldn't feel good. Like, oh
Okay.
yeah. Yeah.
So fantastic.
Yeah.
Sounds like things are going good.
They're going good.
Good.
They're going better.
Okay. So do I see you next week then, or?
I think it's 2 weeks.
Okay. I will actually be on a plane in 2 weeks.
Yeah, where are all these trips you get to take?
Uh, all these trips. What? This.
Oklahoma.
Oh yeah.
You
Well, that
canceled
was in
another one.
June, so I got to work, and then there was Wisconsin, which is family. North Dakota was family. Yeah, this is actually Florida. I'll be working. It's a week. It's a workshop, so I get 1 day off of out of 5.
Okay, so the second you're not going to be around.
No,
Oh, okay. How are you gone the whole week?
I come back. I fly back on the 2nd.
Oh,
That's
let's
my
see.
travel day.
That I could see you that day if you want me to. I mean, the next day. Oh, I have you on Tuesday, the 3rd. I have you already on here.
Oh, there we go. Guess we got
Yeah.
that taken care of.
Yeah, ta-da. And then I'll probably owe you money then too.
At 1 o'clock on Tuesday. Yep, gotcha.
Okay.
Perfect.
All right. I got a call coming. I have to take,
Yep.
there's a bonus call coming. I'm starting at 2. So
Take care and
thank you.
have a good week or a
Yeah,
good
you
couple
too.
of weeks.
Have fun in Florida.
Will do. Thanks.
All right.
Bye-bye.
Take care. Bye-bye.